Hello, everybody. Dr. Lonnie Stewart here from the Healthcare Education Transformation Podcast. Are you a physical therapy student about to start studying for the National Physical Therapy Examination? Or maybe you're a professor, a program director, or clinical instructor who teaches DPT students preparing for the NPTE? Either way, we would recommend checking out our sponsor, NPTE Final Frontier, and the community they've built around preparing for and succeeding on the NPTE. That exam and the preparation that goes along with it can be long, tedious, difficult, and stress-inducing, but it doesn't have to be. NPTE Final Frontier has the tactics and resources to help address all of the usual barriers. They even have scholarships to help with NPTE study courses, FSBPT registration fees, and even research opportunities. And if that's not enough, they're even donating to the very first annual HET Podcast Scholarship to be awarded at the end of every year. Go to npteff.com for all of the details and use code HET for 10% off all purchases. Links to both the NPTE Final Frontier and their scholarship options are available in the show notes. And now, let's get ready to learn.
Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with us today longtime friend and co-host, Dawn Brown. Dr. Dawn Brown, tell us what you're up to these days. Catch us up. Let us know all the things. And then we'll dive into the meat and potatoes of today's episode.
I'm ready for that. I've been up to a lot. I have a new position at Northwestern University's Department of Physical Therapy and Human Movement Sciences. I am the Assistant Chair of Curricular Affairs. I'm an assistant professor in there. I started June 1st, so it's been about 6 months in, and I am enjoying it so far.
I love when people kind of move and shift around and end up at new places, because it's always like a puzzle. They've got to fit into, the courses that are being taught, what their area of expertise is, the faculty around them, the core faculty and people they're working with. It's always so fun to see where people end up and why and how. So I'm glad to hear everything's going well. I'm glad to hear that you found your current teaching position, but the reason that we've got you back on again today is your new appointed position, right?
Yes.
Tell us about this. This is wild, and I love this because this is something that PTs need to know that they have the opportunity to do. And there's been a lot of episodes lately about that, about PTs doing jobs and things that PTs just wouldn't normally think, right?
Right.
EOs, head of research and development, like all these cool things. So tell us about the new position, and we'll dive into that.
Yeah, and you're absolutely right. We think about, the roles and responsibilities of physical therapists, primarily to treat patients, perhaps go into education, do research. But with my new position, I was recently appointed to the Illinois State Board of Health on their commission to fill a seat that was vacant. And this is a position that the Illinois Physical Therapy Association fought for many years to get a physical therapist representative on the Board of Commissions. And there was Babette Sanders. Many people know of her because of her work with the APTA and even the IPTA. She was the first physical therapist in Illinois to have a seat at the table on this commission. And then once that was vacated, it was open and someone recommended me. And much like what you just said, I had no idea that a physical therapist could sit on, a board of health. I thought that it was all physicians, it was all medical doctors and chiropractors, and that us little rehab professionals didn't belong at that table or couldn't find our way to that table. So when I received the email from the Illinois Department of Public Health, from the State Board of Health, that said, hey, you've been recommended, I was like, wait, who recommended me? But then I was like, wait, tell me more. And when I read the description of the position, dealing with things about rules and policymaking and, addressing health equity and access. That's right up my alley. I'm like, I want to know more. I want to apply for this. And so I spoke with a person, several phone calls. I went through a couple of rounds of interviews. I filled out a very lengthy application for this. And then, lo and behold, October 23rd, I believe, they sent me an email and said, congratulations. There was an announcement in Illinois that Governor Pritzker, who's the governor here in Illinois, sent out that said, we filled this position to be confirmed by the Senate. And they had my bio there, and I'm ready to dive in.
I love it. And I think one of the first things we got to talk about is exactly that. It's having a place at the table. Physical therapists are never going to get a place at the table if we don't do our due diligence and fight for our right to party, right? So like you said, this wasn't something that even comes to mind as something that necessarily is done by physical therapists, but the Board of Health is a huge responsibility. I mean, that's statewide. That's several different healthcare providers involved. Tell us a little bit about what this board is made up of, and kind of what their goals and their purpose are.
And so on the board, from what I understand, there's about 20 members that sit on the board. And, the majority of them, from what I've seen on the list, are physicians. There's chiropractor representative. There are a couple of public interest positions. So, the general public can serve on the board, veterinarian on the board as well as some other professions that sit here. And so our primary responsibility as the Illinois State Board of Health is to advise the Illinois Department of Public Health on policies, on rules, to even review some of the standing policies and rules, and even procedures that are there, just to see what needs to be changed. So we're more in an advisory role, and the chair of the Illinois Department of Health takes, some of our recommendations, some of our advice, and then presumably brings that to the direct office of the Governor Pritzker, to be able to utilize that information to address things that relate to health and for the residents of Illinois. And so me sitting on this board as a physical therapist is to be able to bring what our profession has done or what our profession thinks about certain topics that might be brought up. So it's not about me, giving my opinion like, oh, I would do this and not this. It's about what have we done as physical therapists and physical therapist assistants? What has our profession done with, or is doing, or what do we think about some of the topics that are being brought forth? And it's not just from the lens of patient care, but it's also what are we doing in our educational programs? I've looked over some of the minutes that from previous meetings, and there were topics about, what is health education? What are healthcare professionals doing in their educational institution to address things like social determinants of health, access, and risk factors? And so I could lend value and lend a voice at that table to say, well, in physical therapy programs, here's what we are doing, here's why we're doing this, here's what we expect the outcomes to be, not only for our own profession, but for healthcare in general, to meet the needs of the populations of communities.
Yeah, I love that. And I think one of the things that I foresee, and maybe you agree or disagree with this, but like I feel like population health is becoming more and more of kind of a buzzword and gaining some momentum in the world of physical therapy. And I feel like physical therapists are primed to help with population health, all things population health, not only from a student and learning perspective, but also from a job perspective,
Right.
And if that's a direction we're heading, then physical therapists have to have their finger on the pulse of what that means. And population health has a lot of aspects to it, but it's definitely going to help affect the population of the state you live in, right? That's one major aspect, but also subpopulations within that population, right? So I think, having a physical therapist there to help advise and help show what we're teaching in the universities, and then what, we're hopefully going out and getting jobs in, is going to be key for this position. So tell me a little bit about like the length of your term, or like, what you project or what you foresee in the future as far as where you might be able to really make the biggest impact.
I'll piggyback on what you just said in a moment, but the length of the term is a 3-year term. So again, it's an appointed term, not an elected term. So I'm appointed for 3 years, and then I'll see what the process is after that time frame. But going back to something that you said, yes, population health is a bigger buzzword now, even though we've always had it there. Social determinants of health, again, it's gaining more traction, if you will, even though that term or that phrase has always been here, health equity and access. And, this position is timely because I just, in where I am at Northwestern, in our psychosocial course, we just had several modules on social determinants of health and on health equity and access. And some of the articles that we had the students read pertain to these topics. And of note, there was one article, and when we broke out in smaller groups with the students, the article was talking about how only 10 to 20% of what we do as PTs and PTAs with regards to interventions makes a significant impact on the patient. So then it begs us to question, what's the other 80%? Well, the other 80% is us being attentive to social determinants of health, us being attentive to What's health access look like? What's health equity look like? Are we really truly looking at those contextual factors that we always talk about in that ICF model? Are we looking at personal and environmental factors that contribute to the patient's disease or condition or illness, and addressing that in order to optimize that patient's health? It's not just about our intervention. That's a small part, but I think historically in physical therapy and programs, we have really sent that message that it's our interventions that help that individual, and not really honed in on populations, on communities, on those social determinants of health, on those social risk factors. So much like a patient has back pain, and we always teach our students, well, what are the risk factors for back pain? We can tell them that, and the students can rattle those off. But when we ask, well, what are the social risk factors? What are those social determinants of health? Well, we miss the mark because we don't spend enough time talking about that. We might spend a little bit of time, maybe a module, maybe 30 minutes within a module, but we're missing the boat. So I think that we need to shift our competencies, if you will, from just having students being competent about manual techniques, about therapeutic exercise, about therapeutic activities, and put more of the emphasis on competencies as it relates to social risk factors and social determinants of health and health equity and access.
Yeah, and I could not think of a better person to parlay that than you. So, one of the cool things is the way that you just took that and spun it from literally, here's how we're doing it in the universities and the schools, and here's how we're looking to project it into the populations once we graduate these students and get them out there and working, right? So it's a really cool kind of view on how you took something in education and you're able to leverage it into this position that is such a perfect fit for you. And I cannot wait to see the amazing things you do over these next few years. I can't wait to see the journey and just kind of catch up on it. What would you recommend? Like, again, this is something that I feel like, maybe not every state has a representative like this. Maybe, some states do, some states don't. But if we're not fighting for it and we're not trying to get a seat at the table, then we're not even going to have a chance, right? So what are some recommendations or things that you would say if somebody's looking to maybe pursue something like this or get more involved in their state advocacy, especially for physical therapists and educators? What are some tips or tricks or pointers that you would do to maybe get somebody to a point where they're at least, eligible to maybe try some of these things or be recommended for some of these things?
Right. And that's a great question, because oftentimes people hear about this, but they don't know where to start. And whether or not you're a member of any professional organization, you don't have to be. That makes the path a little bit easier per se. For instance, I'm a member of the Illinois Physical Therapy Association, a member of the American Physical Therapy Association. And with our IPTA, we have plenty of members in leadership positions who organize advocacy days, who march down on Springfield to talk to legislators and talk to our representatives about different policies and how that impacts physical therapy and how we can impact populations. That's one way. When we think about in the educational realm, it's about professors really implementing that into the curriculum and saying, okay, it's part of our curriculum, but also it can be outside the curriculum where we have areas or time periods where we have students get together and we just have formal or informal conversations about policy, about rules, about regulations, because at the upper echelon of what we do, if we really want to address population health and address health access and equity, then we have to move from just being downstream, if you will, our interventions, through moving more upstream and saying, let's make sure that at the highest echelon, the upper echelon, we're looking at policies. And I think a lot of that starts in the classroom when students are in their formative years, if you will, and addressing that. And perhaps the educators who are teaching students this, they get that aha moment to say, wait a minute, I'm teaching this. And the more I talk about it, the more I'm like, what? I really do want to be part of the solution. I really do want to be a change agent. Let me actually take this a little bit more seriously, if you will, and let me take the students on a bus down to Springfield or the capital of Illinois, or let me have students write letters to their representatives about things such as fair co-pays and prescriptions, and et cetera. And even for clinicians, those that take students or those that are in clinical practice, part of it is just keeping your ear to the ground. You have to make sure that you are reading. Again, you don't have to be a member, but are you looking at some of the research? Are you reading some of our professional magazines, physical therapy magazines, just so that you stay abreast of what's happening with regards to healthcare and physical therapy, or heck, even turning on the news or reading the newspaper. I mean, health topics abound in many media arenas, social media, print media, etc. Are you staying informed? We can't just be siloed and go to our clinical facilities, go to patients' homes and treat them, and think that's all that we have to offer. If we truly care about our patients' health, if we truly care about our patients and the communities that they live in and the populations that are around them, then we have to do more than what we do with our hands inside of a clinical facility.
And now for a quick shout out to our newest sponsor, Varela Financial. If you're a physical therapist and you have student loan debt, you got to talk to these guys. What makes them unique is that they view financial planning like running hurdles on a track. And for PTs, the first hurdle many of us run into is student loan debt. Varela Financial will help you get over that hurdle. They not only take the time to explain to you which plans you individually qualify for and how those plans work, but they also take the time to show you what your individual case looks like mapped out within each option. So if you're looking for help on your student loan debt or any area of personal finances, we recommend working with them. I use Varela Financial personally, and they were able to help me lower my student loan repayment from about $1,800 a month down to about $135 per month simply by finding the right repayment plan that best fit me, my family, and our life goals. You can check them out at varelafinancial.com. Link is in the show notes if you need it for reference, and tell them the HET podcast crew sent you. And now back to the show.
Yeah, there are so many good takeaways from that you just kind of laid out there. But like, so Texas has some pretty poor direct access laws. We're probably in the bottom 3 of the 50 states. We just recently got direct access, and it's not even that great direct access, but we have some form of it. And I was never a big advocacy guy. I tell this to my students all the time. I am not a go to Capitol Hill, shake hands and kiss babies guy. I'm just not, right? Well, this last advocacy day, they asked me to come and do a speech to kind of pump up the crowd before we went and talked to all the lawmakers there, just because their keynote person had an obligation and had to miss it. And I was local, so they figured, all right, well,
Right.
could you come help out? And I said, you know what? I preach that we have to be big on advocacy, and I'm not a huge put on the suit and shake hands and kiss babies guy, but I really need to be living what I'm teaching. And so for the first time ever, I went, to Capitol Hill here to our state capitol, and on Advocacy Day, I did the speech. I went and I talked to the lawmakers, and I shook hands and kissed babies and did all the good things, right? And I'll tell you what, it made a difference. It really changed my perspective on why this is so important.
Yes.
Why we have to do this stuff. And I'm sold now. I drank the Kool-Aid. I'm all in. I will, whatever you need me to do, just let me know. I'm not great at it. I'm not, I think a lot of it has to stem from like my outside the box thinking and like, entrepreneurial mindset stuff. It kind of makes me, kind of feel like a little bit like an outcast sometimes in academia, or even in just the world of physical therapy, because I don't just think it's a 9 to 5 treatment, clock in, clock out thing. I think it's much more than that. But in reality, that's exactly what we need in order to kind of get those seats at the table and have an impact in many different ways. So like I said, I'm involved. Sign me up. Whatever you need, I'll be there now. I do the best I can now. Our advocacy, we, in Texas, we only meet every other year. That's when the lawmakers meet to do, all of their business. So it's only every 2 years. So it's not even that big of a time commitment, really. I mean, there's a lot of planning that leads up to those 2 years and stuff. But, it's amazing to see, again, how you can take the stuff that you're doing in education and parlay it into much bigger as avenues and aspects, because that's where the things get done, right? The lawmaking, the policy making, and just some of the things that, even like direct access, that's personal. That's like in a physical therapy realm, that sucks. We got to work on that and make it better. But from a bigger picture standpoint, like you said, social determinants of health, that's more patient advocacy, right? We're trying to get these patients the care they need.
Right.
So it's not just about physical therapists, it's about just everybody, right? What are some barriers or some things you see that you might look to make an impact on in the next couple of years for your state, specifically in Illinois there? Like, what are some big barriers you feel like you might face, or big topics you might try to tackle? What do you think might be coming down the pipeline there for you?
I think in my position on the State Board of Health, I will sit on one or two committees, and one will potentially be the Rules Committee, one will be the Policy Committee. And again, I've read through some of the minutes from previous meetings, but just knowing, what's happening in general in healthcare, knowing what's happening in physical therapy, I foresee, and especially thinking about the economy, I foresee many more conversations about financing healthcare, because that's a huge issue. Then what are we doing about the insurance issue, where some people are not able to get the services that they need because they don't have that document that says, hey, I have insurance, treat me, and treat me according to what I need to get better. So I think that's a hot topic. Copays, I know we've been fighting that in Illinois. $80 copays, and if I'm seeing them for more than a couple times a week for, let's say, a surgical procedure, that's a lot of money coming out of their pocket, but versus having our copays in line with what they're getting charged when they go to see their physician. Those copays are generally what, $20, $25? So why are ours so high when they go see their primary care physician or even a specialist? They only see them once every blue moon, if you will, but yet they're seeing us week in and week out, depending on their diagnosis and how much physical therapy they may need. And I know that may potentially be a hot topic, not just from physical therapists, but when I sit in these spaces and if that comes up, I'd be curious to know, well, other healthcare professions, whether it be chiropractors or anyone else that has a seat at this table, what are you all doing? Because maybe what you're doing, I think, can lend value to help me inform, our Physical Therapy Association, our legislation within our own profession, and vice versa. So I think those are some key hot topics. And I know, healthcare education is definitely a significant topic that they've discussed over several meetings. What is it exactly that we're teaching students, and what should we be teaching them with regards to, interdisciplinary practice, care, and even, getting them to think more just from an individual perspective, but really looking at how can we make a difference in communities that will have a positive impact on all residents in Illinois, regardless of your sociocultural identities, regardless of your circumstances. How can we make that bigger impact? And again, I always say moving upstream. That's where the policies come in. That's where the legislation comes in. That's where people getting outside of their comfort zone, whether you're a student, whether you're a clinician, getting outside of your comfort zone and just start small. Write that letter that, for the most part, where we are in Illinois, those letters to your representatives, they're already pre-made. You just need to read it, make sure that you're in line with what it says, sign it, send it off. And the more of those that they get, the more it might persuade them or change their attitude toward positive health policy changes.
We just went through a Fair Copay Act here in Texas, and that got ugly. So we got more work to do on that one. But again, I love the fact that, again, you were able to parlay your past, your career, your experience into this cool position. Congratulations again on the appointment. It's just so huge. And like I said, I can't wait to see what it brings. My big question then becomes, like, this is an amazing opportunity for you, right? And like, it doesn't stop there though. It feels to me like there's so much more even beyond this. So like, what do you see in the pipeline for you and your future? What do you see? You're already doing so many big things. I don't know how you top this, but I'm wondering, what does your 5 to 10 year plan look like from here? Like what, and this is crazy because you're coming into this board position right in the middle of an election.
Right. That's the thing.
Which is going to be crazy. But that being said, like what do you see for the future for yourself in the next, 5 to 10 years?
So I guess I shouldn't say running for governor since I'm already in that space. But no, I won't get out, but you never know.
I was going to say, would not surprise me at this point.
But I see myself, again, this is a 3-year position. I'm excited just to dig deeper into it. But, hopefully I'm able to add value to this commission and they add value to me, not just from a personal perspective, but from a professional perspective. And so, like you said, the possibilities are endless. I mean, hopefully after the end of this term, depending on elections, et cetera, that I'm appointed for another term, especially as I gain more traction and really get to understand and navigate this position. And then again, looking at how it can influence, the Physical Therapy Association at the chapter level, but then also taking to say, hey, as our national level, as the APTA, what can I bring from what I've learned, from what I'm discussing within the State Board of Health to the national level, and even, finding out what other states actually have physical therapists that have a seat at the table with the State Board of Health. So, I'm sure there are many other states that have a physical therapist at the table, and perhaps with them, collaborating and saying, hey, how do we take this information that we are using and that we're giving and using it more for the benefit of physical therapy and the physical therapy profession in the grand scheme of healthcare. So my goal is just to do the best I can with this position, make a positive impact on the communities, on the residents of Illinois, using this information to help inform what we teach and how we teach in our physical therapy programs, and just moving forward. So again, I don't know exactly what the future holds, and that's probably a good thing. So I'm just going to ride the wave while it's here.
I love it. I love it. And I hope the big takeaway message for me there was, like you said, the future is yet to be determined, but I'm just going to go with it. And I hope that
Yes.
physical therapists and other healthcare practitioners alike that are listening realize the opportunities that are in front of us. Like
Right.
it doesn't just have to be a clock in, clock out 9 to 5 clinician. There are
Right.
so many more things that we can do, and that we have the permission to do. Like literally, we have earned a
Yes.
seat at the table for these things. So you got to just go for it. You got to see where the path takes you and see what you can leverage it into and just ride the wave, like you said, because I think that honestly will lead to some of the best opportunities for physical therapists in the future, which will then trickle down and benefit other therapists in the future too. So thank you for doing the hard work. Thank you for putting yourself out there and just going for it. I love it.
Yeah.
Always love talking with you. We do ask again our guests, this one question each and every time. If you could change one aspect of higher education, whether it be physical therapy or otherwise, what aspect would you change and how would you change it?
So one aspect of higher education, I would just say for higher education in general, is to really take a deeper look at the curriculum. And I'm going to be biased with this because that's my role at Northwestern, the Assistant Chair of Curricular Affairs, but really looking at your curriculum and saying, does it contain the content that students really need to make a significant positive impact in society? Not just, again, I go back to not just at the lower level, it's important to treat individuals, to treat the patients, but are we really looking at it to the point where our students are coming out saying, hey, the sky is the limit, that I can treat patients, I can be an educator, I can sit on, state boards of health, that I can actually fulfill, we go back to our core values, my social responsibility to gain that trust with the greater society and to be able to address their health needs so that they can all live a healthy life. And I think we really need to critically examine our curriculum. And I know that's been a hot topic at many of the professional conferences that we go to. And again, there's not one right way to do it, but I think we need to really take a more critical look at that.
Yeah.
And why we teach what we teach. What's the impact?
I love it. I love it. It comes down to that very simple question of what they need to know versus what's nice to know versus what's nuts to know, right?
Exactly.
We got to examine that and just determine like what needs to be in there and what doesn't.
Exactly.
And like I said, there's no right or wrong answer, but there's a good foundational base that we can use, that we can all use across the board. So hopefully we figure that out one of these days in the near future, because it's definitely a tough spot and it's costing a lot of people a lot of money. So hopefully we can kind of narrow in on it and really find some best practices. And I even think that means that there's going to need to be more educational research done. So anybody out there listening that has funding for educational research, send it our way, because we need it. We're going to need it. And it's at the basis of everything we do, right? Education and teaching is at the basis, no matter if it's physical therapy, occupational therapy, medicine, doctor, whatever. We teach. We have to teach this knowledge. We have to transfer this knowledge. And that comes from a lot of best practices in healthcare education. So well, Dawn, like I said, thank you so much for coming on, spending your time and telling us about this neat position that came your way. Tell us a little bit about where people can reach out to you and find you. If they have follow-up questions or they just want to see what you're up to these days.
I would say the easiest thing that comes to mind is you can email me. I can't remember my social media handles, but Dawn Brown's not a very common name, so you can find me. But definitely you can email me with any questions, comments, or just if you want to chat. So dawn.brown@northwestern.edu. I do have a social media presence on LinkedIn and on Facebook as well, primarily on LinkedIn, but definitely feel free to reach out. I'm always game for having conversations about this kind of topic that I'm so passionate about.
Awesome. And we'll put those in the show notes so everybody can find you. Dom, thanks again for your time. Like I said, always a pleasure. And I look forward to some of your future episodes.
Thank you so much. I'll talk to you soon.
Well, I hope that episode was entertaining as much as it was informational and educational. If you enjoyed this episode or any of our past episodes, we ask you to please subscribe to the podcast and leave us a rating and review. And please share out the episodes to those who you feel may be able to benefit from them. We also urge you to follow us on all social media platforms at HET Podcast and let us know what topics or experts you would like to hear from in future episodes. And just as a reminder, none of the information on today's show should be considered medical advice. It's simply infotainment or edutainment to help educate our audience. For medical advice, we always advise you to reach out to your preferred medical professionals, and we'll see you on the next show.